Has someone you love recently started showing subtle but concerning changes? Many people believe that death in old age arrives suddenly, without warning, but often the body begins to send quiet signals months, even a year, before life reaches its final stage. The problem is that these early signs are easy to miss. They seem minor, part of ordinary aging, and so families overlook them. It's only later, in hindsight, that we realize the signs were there all along. By then, it's too late to prepare, too late to have those important final conversations or make cherished memories. Recognizing these changes early allows families to provide better care and ensure their loved ones pass with comfort, dignity, and peace. Let's talk about 5 key signs that can appear as early as a year before an elderly person nears the end of life. These aren't just signs of aging. They often signal the body's gradual decline. Understanding them gives you a chance to respond with empathy and make thoughtful choices. The first sign is significant weight loss. This often happens subtly at first. Perhaps a belt that suddenly fits looser, or clothes that hang differently. You may notice an elderly person isn't eating like they used to, or they say they're not as hungry. Families often brush this off as just another part of getting older, but when someone loses weight without trying, it's often the body's way of signaling that something more serious is going on. As the body ages, it becomes less efficient at absorbing nutrients. Muscles shrink, and essential systems begin to slow down. Although aging causes some muscle loss, rapid or ongoing weight loss suggests that the body is struggling, may be unable to properly digest food or process protein. This loss of strength can make movement harder, increase the risk of falls, weaken the immune system, and leave the person more vulnerable to infection. Another factor is a change in appetite. Many older adults no longer feel hunger the same way they once did. Their taste changes, food becomes less enjoyable, and they begin to skip meals or eat smaller portions. This isn't just preference, and it's a biological shift. As the body begins to shut down, it stops sending the brain strong hunger signals. The result is reduced energy, diminished strength, and a gradual decline in overall well-being. Underlying health issues may also contribute. Chronic conditions like cancer, kidney failure, or heart disease can trigger weight loss before other symptoms even appear. Mental health changes, like depression or early dementia, can also lead to eating less. Some families try to encourage more eating with favorite foods or nutritional supplements, but if weight continues to drop despite their efforts, it's likely not just about food. It may be the body preparing for its final transition. In such cases, forcing large meals isn't helpful. It's better to focus on comfort, offering soft, easy-to-eat foods, and keeping the person hydrated. If your loved one is losing weight, seems weaker, or is less active, take note. This isn't just about appearance, it's about understanding what the body is communicating. And once you recognize that message, you can begin to prepare with compassion, ensuring the time left is lived with meaning. The second sign is deep fatigue and weakness. This is more than just the usual tiredness that comes with age. It's a constant exhaustion that doesn't go away with rest. Everyday tasks like getting out of bed, dressing, or walking across the room become exhausting. Things they once did with ease, cooking a meal, chatting on the phone, or even reading, may feel overwhelming. This fatigue isn't laziness. It's the body conserving energy. As organs begin to slow, the heart may not pump as efficiently, blood circulation may weaken, and muscles receive less oxygen. That's why seniors in their final months often feel unsteady and too tired to do much. Their metabolism also slows. The body stops producing and using energy the way it used to, redirecting resources toward preserving essential functions. People begin sleeping more, napping longer, and finding it hard to stay alert. You might see sudden drops in energy. A person may seem fine in the morning but become completely drained within an hour. This exhaustion also takes an emotional toll. Seniors who once valued their independence may become frustrated or ashamed that they can't do as much. They might withdraw from others, skip conversations, or stop doing things they love. It's not because they don't care, they simply don't have the energy. This can lead to a difficult cycle. They withdraw more, become less active, and the decline accelerates. For family members, it's hard to watch this shift. But pushing them to do more usually won't help. What they need most is your understanding. Let them rest, make their environment peaceful, and cherish the conversations you do have. Deep, unrelenting fatigue is often a clear sign that the body is going through a significant transition. Recognizing it allows you to adapt and focus on comfort rather than unrealistic expectations. The third sign is increased confusion or emotional withdrawal. Changes in cognition and interaction can start months before death, even in those who were once mentally sharp. Your loved one may begin forgetting things, repeating questions, or having trouble following conversations. They may get lost in familiar places or become disoriented about the day or time. These aren't just senior moments. As the brain receives less oxygen and nutrients, its ability to function begins to slow. That can lead to confusion, difficulty, making decisions, or forgetting people they've known for years. Some people experience moments of clarity followed by sudden confusion. It can feel like their mind is flickering in and out. Another sign is emotional withdrawal. Many people stop engaging socially. They speak less, respond less, or simply sit quietly. It's not a lack of love, it's that their brain and emotions are no longer functioning in the same way. Conversations become tiring, loud or active. Environments can be overwhelming. Eventually, some people retreat into silence. Mood changes can also occur. A calm person might become anxious or irritated. Someone once expressive may seem indifferent. This isn't intentional. It's a result of cognitive decline. Families often find this phase heartbreaking. It can feel like losing someone emotionally before they are physically gone. But instead of trying to bring them back, the most loving thing you can do is meet them where they are. Speak softly. Offer gentle touch. Reassure them with calm words. Even if they can't always respond, your presence still matters. If your loved one is becoming forgetful, less social, or confused, don't dismiss it. These signs are often the brain's way of preparing for the final transition. It's a time to be patient, to offer peace, and to create a space that feels safe, familiar, and loving. The fourth sign that an elderly person may be in their final year is an increase in infections and slower healing. As the body begins to wind down, the immune system becomes weaker. You might notice your loved one catches colds or infections more often, or that minor illnesses take longer to go away. What used to be a small issue, like a sore throat or a scrape, may now linger or require stronger treatment. The reason is simple. The body can no longer repair itself or defend against illness as effectively as before. One of the most noticeable signs is repeated infections. Conditions like pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections can become more common. These aren't random occurrences. They're part of a larger pattern. The body's defenses are fading, and it's less able to fight back. You might find that even after treatment, the same infections return. Antibiotics that once worked well may not be as effective. It may take longer courses of medication, and sometimes nothing seems to help much at all. You may also notice that small cuts or bruises don't heal properly. The skin may stay damaged longer than it used to. Sometimes wounds reopen or bruises last for weeks. That's because circulation is slowing, which means that oxygen and nutrients aren't reaching tissues the way they should. This reduced blood flow slows healing, especially in the hands, feet, or other extremities. In people who are less mobile, pressure sores may develop. These can be serious, and if untreated, can lead to further infections and pain. Even more concerning, infections in the elderly don't always show the signs you'd expect. Instead of spiking a fever, an older person may just seem more tired than usual. They may eat less, act confused, or seem disoriented. These are often the first signs of infection in seniors, and they can be easy to miss. That's why it's so important to pay attention to small shifts in behavior or alertness. For families, this stage can be deeply emotional. It's tempting to seek out one more test, one more treatment, or one more medication that might help. But as infections become more frequent, it may be time to shift focus from curing to comforting. That means making sure your loved one is hydrated, keeping their skin clean and moisturized, and managing pain gently. Sometimes small steps, like adjusting pillows, using a humidifier, or offering a warm blanket, do more than another round of pills. At this point, your care and presence mean more than any prescription. The fifth and final sign is a change in breathing and circulation. As the body prepares for its final stage, breathing often becomes irregular. You may notice your loved one breathes more slowly, more shallowly, or pauses between breaths. Sometimes they may breathe very fast for a moment, then stop for several seconds. This pattern, called Cheney-Stokes respiration, is common in people nearing the end of life. It's a natural rhythm the body enters as energy fades. You might also observe that they start breathing through their mouth more often. They may become short of breath during simple movements like sitting up or talking. If someone who used to walk across the room easily now becomes winded after standing up, it's likely their lungs and circulation are declining. Sometimes fluid builds up in the lungs, leading to coughing, gurgling, or a feeling of pressure in the chest. While it can sound alarming, it's often just another part of the body's natural slowdown. Another clear indicator is coldness or color changes in the extremities. You may notice their hands, feet, or even ears become cold to the touch. Their skin might look pale, bluish, or mottled, especially on the fingers or toes. These signs show that the body is pulling blood toward the vital organs and away from the outer areas. It's no longer focused on keeping the whole body warm. It's prioritizing only the functions necessary for survival. This can be hard to witness. As a family member, it's natural to feel anxious or afraid. You might want to help them breathe better or fix the issue. But often this isn't something that can be reversed. Instead, small comforts make the biggest difference. Keeping the room cool and quiet, using soft lighting, helping them stay upright, or giving them sips of water can all help ease discomfort. In some cases, oxygen therapy or medication may be offered, but the focus typically turns toward easing symptoms, not extending time. When you begin to notice these changes in breathing or circulation, it's a powerful sign that the body is slowing down. What your loved one needs most is a calm, supportive environment. Your gentle presence and quiet reassurance can bring more peace than any medical treatment. Let them know they are safe, that they're not alone, and that they are deeply loved. Now, as we reflect on these 5 signs, significant weight loss, deep fatigue, cognitive decline, increased infections, and changes in breathing, it becomes clear that the body has its own language. These signs are its way of preparing for the final transition. They don't always appear in the same order, and not every person will experience all of them. But when you start to see them, it's time to shift your focus, not toward fear or denial, but toward compassion and preparation. For families, this journey is filled with emotion. It's natural to feel sadness, to want to fight back, or to hope for more time. But sometimes the most loving thing we can do is accept what is coming and make each moment count. That means sitting together quietly, telling stories, holding hands, or simply being present. It means listening to what your loved one's body is saying and responding with grace instead of resistance. Understanding these signs is not about giving up. It's about showing up as a caregiver, a friend, a child, a partner, with awareness and love. It's about making the final chapter one of dignity, connection, and peace. As we come to the end of this journey, it's important to take a moment to reflect. The 5 signs we've discussed, significant weight loss, persistent fatigue, cognitive decline, frequent infections, and noticeable changes in breathing and circulation, are not just physical symptoms. They are messages from the body gently letting us know that time is limited and that change is near. Recognizing these signs doesn't mean giving in to despair. On the contrary, it's a call to action, not to prolong life at all costs, but to enrich the time that remains. Too often, families miss the chance to say the things that matter most. But when we are aware, we can slow down and focus on what really counts: love, connection, comfort, and peace. When you start to see these changes in someone you care about, Consider what truly matters in those final weeks and months. Sometimes it's sitting beside them in silence. Sometimes it's reading their favorite book, playing familiar music, or simply offering a warm meal, even if it's only a few spoonfuls. At this stage, presence is far more powerful than perfection. For many families, these moments become some of the most precious memories. There is clarity that comes with knowing the end is near. It allows us to forgive, to thank, to express love, and to be fully present, not just physically, but emotionally and spiritually. The opportunity to say goodbye is one of life's rare and sacred gifts, and not everyone gets it. If you are walking this path now, caring for an elderly parent, a partner, or a dear friend, know that your presence matters more than you may realize. You don't need to have all the answers. You don't need to fix everything. Sometimes just holding their hand or listening to their stories is the greatest comfort you can give. Remember, the final chapter doesn't have to be filled with fear or loneliness. It can be filled with meaning, dignity, and a deep sense of peace. Creating an environment that feels safe and familiar, offering gentle words of encouragement, and simply being there. These are the things that carry the most weight. And when the time does come, it can be a moment of grace, a release, a peaceful transition that reflects a life well lived and well loved. You are not alone in this. So many families have walked this path. And while it is never easy, there is strength in knowing what to expect. There is peace in understanding what the body is trying to say. And there is comfort in knowing that every moment of kindness, every small act of care makes a difference. Thank you for taking the time to understand these important signs. May this knowledge bring you greater compassion, greater presence, and greater love as you support someone through the most sacred part of life's journey in its closing chapter.